Good morning, and thank you for joining today's Knockout Opioid Abuse Day Learning Series webinar. All participants are muted. If you have a question, please use the chat feature. We will address all questions at the end of the presentation. To get us started, I would like to introduce the Partnership for Drug-Free New Jersey's Director of Opioid Response and Prevention Outreach, Angela Conover. Angela.
Thank you, Greg. Good morning, everyone, and thank you for joining us for today's Knockout Opioid Abuse Day Learning Series webinar, Burnout on the Frontline, Managing COVID-19 Fatigue. This webinar series is a continuation of Knockout Opioid Abuse Day, which was designated as October 6th each year by Governor Murphy. And this learning series is designed to continue the awareness and education highlighted by that initiative throughout the year. Burnout on the Frontline, Managing COVID-19 Fatigue is brought to you by the Partnership for Drug-Free New Jersey and is being held in collaboration with NJ Cares and the New Jersey Office of the Attorney General. And I thank them for their partnership, support, and collaboration on today's learning activity. To deliver some opening remarks on behalf of the Division of Consumer Affairs, I'm pleased to welcome Caitlin Caruso, Acting Director, New Jersey Division of Consumer Affairs. Welcome, Caitlin. Good morning.
Good morning. Thank you so much, Angela. Good morning, everyone. I obviously wanted to start by thanking the Partnership for Drug-Free New Jersey and NJ Cares for making this webinar possible. I'm honored to be here today. Most importantly, thank you, everyone who is joining us, for your work on the front lines. Saving lives and protecting the public in the middle of COVID-19 is a dedication in the midst of a crisis that deserves more thanks than I can hope to convey, but I do mean it. Just to introduce myself a little bit, I'm the Acting Director at the Division of Consumer Affairs. I recently took on that job, but I've actually been with the division for a few years, and I'm really grateful for the team there that's been hard at work and that I now have a chance to lead. So at DCA, you may know or not, we're in part a civil law enforcement agency, and we're part of the Department of Law and Public Safety. So obviously, frontline public safety and law enforcement workers are always near and dear to our hearts. Those of you in law enforcement probably know that your well-being is a big priority for the Department of Law and Public Safety as a whole. 2 years ago, General Graywall implemented a first-in-the-nation program to support the emotional and psychological well-being of law enforcement officers. AAG CPL will tell you a little bit more about that in a bit, and I can't praise enough his efforts as Chief Resiliency Officer, which are especially crucial right now. But DCA is actually also a licensing agency. Many of you probably know us in that context. And today I actually want to focus my comments more on the efforts that we've taken to help our healthcare licensees respond to and cope with the pandemic. As background, DCA staffs and supports 51 occupational and professional licensing boards. These boards license and regulate 750,000 people, including 300,000 healthcare practitioners in various licenses. So DCA is not surprisingly part of Governor Murphy's whole state response to the COVID-19 pandemic. With our partners on the boards, we work with Department of Health, and others to try to provide guidance to healthcare providers. And we're working hard to keep making the changes as the situation changes on the ground that will allow you guys to do your jobs safely and efficiently and sustainably. So first, we know that there's just been a shortage of help. Healthcare is stretched thin, and short staffing and long hours only worsen stress and burnout. So to respond, the division has actually implemented several emergency licensing programs to grow the number of healthcare practitioners in the state. So some of you may already be working alongside one of the thousands of recent retirees or recent graduates or colleagues coming in from other jurisdictions that are here to practice during the pandemic. We've also issued guidance to support the safe reopening of certified homemaker home health aide and nursing training programs to make sure that we're also continuing a pipeline of qualified new professionals who are there to support and work side along all of you to care for New Jerseyans. Second, we've worked to minimize person-to-person contact and expand access to healthcare through telemedicine. You probably know New Jersey broadly authorized telehealth practice in 2017, but during the pandemic, we've actually expanded it to do things like making it easier to establish a practitioner-patient relationship remotely, to communicate with your patients on whatever private platforms work best, and to prescribe and manage CDS, controlled dangerous substances, in appropriate cases remotely. When in-person care is necessary, though, we're also working to create safety protocols for licensees and office practice settings to help protect you and your staff and your patients. Next slide. We've also tried to keep up active outreach to help everybody stay up to date on all of the changes, and there have been many that have been necessitated by COVID-19. This includes virtual programs on topics like epidemiology, infection prevention, testing essentials, addiction treatment, and mental health. And these have relied on our crucial partnerships with things like Rutgers Project ECHO, Rowan University's School of Osteopathic Medicine, and obviously Partnership for Drug-Free New Jersey and NJ Cares. Finally, and perhaps most important on point for this discussion, we're encouraging our licensees to look for extreme signs of stress and burnout in themselves and their colleagues, and to seek help when necessary. After more than a year of intense workloads and trauma, treating people who are affected by COVID-19, we recognize, although we probably can't fully appreciate, the kind of strain that you're under. You may be overwhelmed or experiencing anxiety and exhaustion, or you might honestly not be feeling that much at all. All of that is totally understandable given what's been asked of you this past year. But recognizing the signs and making time to care for yourself is really critical to coping and being able to continue providing care for others. It's why I'm so grateful today that we also get to hear from Dr. Chantal Brezo, who has deep expertise in the field of professional well-being, and from Erica Shortway, who's going to talk to us a bit about the impact of COVID-19 on addiction recovery specialists and resources that are available to help cope with burnout due to COVID-19. All of our panelists today will be sharing some invaluable information to support resiliency and well-being for you and your peers. I hope their wisdom and experience give everybody here a skill or a resource or a perspective that you can take away that will help you cope as we continue to wade through the ugliness of this pandemic. At DCA, we've also compiled a short list of mental health and resiliency resources, including some that are targeted specifically to first responders. You can find these by going to the link that's on your site, and it'll be in the slides that are shared at the end of the program. Also, if you're one of our healthcare licensees, you may have already seen some of this information, actually. We've reached out by email and video and social media. If you haven't seen any of this before, let us know, get in touch, reach out to your professional board and make sure you're getting all of the most up-to-date information from us about coping and also about your practice. Overall, thank you. Thank you for joining the seminar. Thank you for the work that you're doing. Thank you for taking time to think about and address the importance of managing stress during COVID-19. Your well-being matters. It is part of your ability to get through this crisis, and it is part of how you care for the rest of us. We all need help getting through this. Please ask for the support that you need. Thank you so much. I'm really excited to learn from our panelists today.
Thank you so much, Acting Director Curso, for your comments today and your understanding of the crisis and what so many people are facing, and also for the leadership of your Office of Division of Consumer Affairs and the Office of the Attorney General in addressing the opiate addiction crisis in our state. I know that's ongoing and really goes hand in hand with the mental health crisis that we are all addressing during this COVID pandemic as well. I now want to welcome our very varied and expert panel of featured speakers for today's webinar. We have Dr. Chantal Brezo, the Dean of Faculty visiting from New Jersey Medical School. We have the Chief Wellness Officer, and she's also the Chief Wellness Officer, at Rutgers Biomedical Health Sciences. We have Robert C. Peel, Jr., he's Assistant Attorney General and Chief Resiliency Officer for the New Jersey Resiliency Program for Law Enforcement. And we have with us Erica Shortway, Director of Recovery Services for Morris County Prevention is Key Center for Addiction Recovery, Education, and Success Cares. So welcome to all of our panelists. I thank you for being with us here today and participating in this learning activity. And Dr. Brezo, I will turn things over to you to begin.
Hi, thank you so much for having me and for the kind introduction. We'll start right away. Next slide. I want to take some time today to talk about the stages of disaster recovery, talk about the stressors that are experienced by health professionals, and talk about ways to help us cope using principles of psychological first aid. Next slide. If you look at this graph of community phases of disaster response, you see that at the beginning, which was for us in in the spring, this past spring of 2020, there's sort of a positive emotional response as people come together to respond to the disaster. But at the end of the peak, then the emotional energy kind of slows down as people now have the time to think about what happened. Perhaps, they grieve people whom they lost, or the way of life that's no longer the same. And so this is called a period of disillusionment. And in the case of COVID-19, this is even more complicated and extended with the second surge and other stresses, with racial and political events that have occurred nationally. And all of that put together really complicates the curve and really promotes that sense of fatigue and just a prolonged sort of a disaster feel. The next slide, I go over some psychological and behavioral responses to disasters and pandemics. And I want to point out the largest circle really exemplifies resilience. So people are resilient. We are able to pull together resources and coping. And at the same time as being resilient, we can also experience distress and changes in our health risk behaviors. And there's a spectrum that continues all the way to some psychiatric disorders. And so common signs of distress: sleep disturbances, not feeling safe, some physical symptoms, or even some irritability and wanting to isolate. And then, of course, changes in health risk behaviors, which increases in alcohol, tobacco use, substance use, as well as family distress, and even some conflicts or even some interpersonal violence can happen, as well as the psychiatric illness, as I mentioned before. The next slide, I just want to point out some particular responses that are unique to pandemics as disasters. You can see them there, but isolation in particular, with reduced contact with loved ones or people that we're close to, is particularly difficult. And there's also the issue of stigma. For example, healthcare workers really being appreciated, but at the same time also kind of avoided or feared because they may be more likely to contract the illness. And so there's all of that mixed together that adds to the stresses in pandemics. Next slide. Particular challenges for healthcare or frontline professionals. There's a lot of fear for personal or family safety. There's guilt of not being on the front line for healthcare professionals who are doing telemedicine, for example, or those who are on the front line not being able to save a patient, or their fear of bringing the virus to the family, so they feel guilty if people in their family are sick. One thing about this pandemic is the sustained stress. So the high workload, the feeling, and sometimes the actual not having a lot of time for basic self-care, and the usual stress reduction that we may all do, whether it's exercise or feeling connected with our family, is just not there to help reduce that stress. Constant protocol changes, hearing what's happening in the news, all contributes to that sustained stress. And then there's the other kind of sort of the more traumatic stress, where people get exposed to things they never thought they would have seen before, and such as in this case, seeing so many people die or seeing patients die alone, which is very morally distressing for healthcare providers. The next slide just shows you some percentages of healthcare workers across the world who've had symptoms of depression and anxiety and stress. And I want to point out in particular, though, the New York City study, which also looked at meaning and purpose. And they did find that 61% of people who were working in the healthcare field did show increase in the sense of the meaning or the purpose of their work. The next slide is a reminder that burnout existed even before COVID-19. Burnout is a condition experienced at work of lost energy, lost enthusiasm, lost confidence. And those who experience these symptoms before COVID-19 may be more at risk for some emotional consequences of facing COVID-19. Next slide. So in periods of crisis, we really tend to go back to our basic needs. And so there's an approach called psychological first aid that really pulls together what these needs are. And you can actually look this up on an app, which looks just like that, which is an app from the Veterans Administration. And it goes over the principles of safety and calm and efficacy and connectedness and hope. Next slide. So feeling unsafe triggers the stress response, which really impairs our functioning. And so safe behaviors, beyond just being safe in and of themselves, they help people function better. It's part of our emotional coping. So for a pandemic, obviously the safe behavior of the mask, proper, distancing, those types of precautions are important. And there's also the safety that comes from information, so that, not having enough information, people don't feel safe with that. Having too much information can also impair our sense of safety. So finding the right balance of having enough information to know what's going on without watching the news over and over again, to decrease, so that we have that balance in our sense of safety. The next slide goes over the calm piece. So too much anxiety, impairs our function. We need to have some vigilance, which is good. But the problem with this pandemic is the sustained stress that really can cause a lot of anxiety. And one of the best way to deal with sustained stress is to plan mini breaks throughout the day. One of the best mini break is deep breathing. So just taking less than a minute to breathe in slowly to the count of 4, pause for 2, and breathe out slowly to the count of 6. And just repeat that. In and of itself as a small break. And some people even set their timer throughout the day to remind themselves in the midst of everything that they're doing to take that pause for breath can make a huge difference in the energy level at the end of the day. In addition to formal relaxation techniques or exercise or anything that gives you positive emotions. Some places have respite rooms where people on the front lines can step out for a few minutes and decompress. The next slide talks about self-efficacy, and really there's 2 parts to that. The first part is how we talk to ourselves, and stress really changes how we talk to ourselves. And many of us in the helping professions tend to focus on others and be very hard on ourselves because we have high self-expectations of what we should do for others. So it's important to identify the thoughts that can cause us distress or can cause us trouble, and ask ourselves, is this realistic? Is this how I would talk to a friend? And what did I know at the time that I made this decision? So that we can change our thinking from perhaps being very hard on ourselves, going from, I should have done this, to I did the best I could in a really difficult situation, to help maintain our self-efficacy. The next slide goes over some basic self-care. So we have to take care of ourselves in order to be efficient. Sleep is the ultimate form of self-care. It also helps our immunity. So it's important to plan sleep if we can, and eat. A lot of people find that they skip meals. So keep snacks in the pockets of your white coat as you go through the day. But it makes a huge difference as well at the end of the day in the efficacy. Little tips: if you know that you're fatigued going into a shift, a protein-rich meal can help fight fatigue a little bit. And then at the end of a shift, when you want to rest, a slightly higher, like a carbohydrate-rich meal can help with sleep a little bit more. The next slide brings the issue of connectedness, and staying connected to our peers is really, really crucial. Those are the people with whom we share stresses of work and can understand what we go through. And so then the next slide, we develop a mnemonic at our school to help everybody remember to check on yourself and check on 2 people. So we call it check you, check 2. Check you means self-care and self-awareness. Eat well, hydrate, pace yourself, those mini breaks, and rest. Know when you need to unburden and decompress. And then check 2, checking in on 2 colleagues a day for 2 minutes of decompression. Ask how they're doing, listen attentively, and acknowledge their experience. Even just listening is very powerful. Some places have buddy systems where 2 people are assigned to each other to check on each other and ask how they're doing, and listening and acknowledging experiences. That's all very important, because in this virtual world with, isolation and so on, it's important that we do everything that we can to maintain the connection. And finally, the next slide is about hope. And our brains tend to focus on problems and ignore the positive, because solving problems is part of survival, and it's part of what we do as professionals. And so this is even more the case during a disaster. And so we have to intentionally notice the positive. And one way to do this is to think about 3 good things that happen through the day. Just taking the time at the end of a difficult day to reflect on a thank you that somebody said, a meaningful encounter, or checking in with somebody and it made a difference. It can help, again, refocus the brain to think about the positive, bring a sense of hope, which is important to help us cope. Next slide. So there are many resources on the New Jersey website that were mentioned before. I list some of those here. There are some additional ones. Some include help with mental health professionals. Some include telephone peer support. Those will be available to you in the chat. And then the next slide, I just want to point out a couple of mobile apps from the VA. There's COVID Coach and CBT Coach to help with sleep that you can carry on your cell phone and help you at any time. It's important to remember, though, that we are resilient. People have done amazing things to cope with this. And stress reactions and the fatigue that we are all feeling are very common. And so we need to be there for each other. And if you find that those reactions and the fatigue continue more than 2 months or impair functioning, that's when you really need to seek help. And my hope is that we've learned a lot of coping skills, and we've grown from this. And I hope that we'll continue the coping skills to pave the way for growth after the pandemic. So thank you very much.
Thank you, Dr. Brazel. I have to say, your tips and resources, while I know many of them designed for frontline workers and prescribers out there, really cross, I think, all careers and all professionals, and really all people who are living in this time. So I thank you for that. I want to mention that the resources that the doctor mentioned are being added to the chat, as well as the resources that the deputy director mentioned earlier this morning. So they're also in the chat feature. You can review those, and a copy of this presentation will be sent to you after, so you'll have them on there as well. So thank you again. I now welcome our next speaker, Assistant Attorney General Robert Seafield Jr.
Thank you.
Good morning, Robert. Welcome.
Thank you. And it's a pleasure being here and speaking about the New Jersey Resiliency Program and how it translates to all first responders and the positive psychology model that was talked about just now, how we taken that model and now created a whole program for police officers, and our belief that it would translate to all first responders and even those individuals that are not first responders. We call this a blueprint for all frontline workers to deal with the stresses of COVID-19. Next slide, please. I'm a lawyer. I can't shut it off. So this basically says that my presentation is in compliance with 17 U.S.C. 107. Next slide. 10 minutes. We have around 10 to 12 minutes to talk about our separate silos here and our separate programs. And 10 minutes can change a life. I know somewhere within the sound of my voice, there may be someone who may be struggling, or may know of someone who's struggling, or may think that someone or a coworker may be struggling, or a family member of the coworker may be struggling. And how do you help? How do you change a culture especially when we're dealing with, as I do with law enforcement officers, where for a law enforcement officer, they are the first to run towards danger and then really bad at taking care of themselves. They take care of everyone else before they take care of themselves. And so we have to be concerned about that. And the resiliency program deals with that in the state of New Jersey. So 10 minutes can save a life. Hopefully, during this presentation, the 10 minutes I share with you may change someone else's life. We're going to talk about the resiliency program. We're going to talk about the basic concepts of resiliency training, and we're going to talk about resources available through Cop to Cop and the resiliency program. Next slide. So what does it mean to be resilient and to actually have resiliency? Next slide, please. Well, it means a number of things. And in the state of New Jersey, we actually created the resiliency program for law enforcement officers to, as I indicated, change culture. The resiliency program was actually created in August of 2019. The Attorney General mandated that all law enforcement agencies have a resiliency program officer, an RPO. We have over 850 RPOs statewide in every municipality. And basically, the whole job of the RPO is blue helping blue, officers helping other officers to deal with pre-boom. And we mean by pre-boom, before individuals are depressed, before individuals have suicidal ideations, before individuals and help individuals before they actually go down that really dark hole and that really dark path. Basically, a friend, a lifeline, someone to talk to. We liaisoned up with the Police Chaplains Association and from the Police Chaplain Program basic training course as well, who have also been involved with us. And we created a law enforcement training program to be implemented statewide. COVID kind of delayed or slowed down our implementation statewide, but we are still pushing out the program even with all of the restrictions that we currently have. Next slide. What's the resiliency program based upon? Trust and confidentiality. So within our policy itself, we have confidentiality, which mirrors EAP. And that was the model that we used when we created the resiliency program. So if a RPO is speaking to another officer, their communications are confidential with two exceptions. One, if the officer advises or the resiliency officer believes that individual may be dangerous to himself or others, then we have to report by law. And secondly, because we have actually law enforcement officers and prosecutors being the role of RPOs, if an officer admits to a crime during a session or a discussion or a future crime, then they have to report that as well. Next slide, please. Why is resiliency important? Well, in a general context, law enforcement is a tough profession. Prosecutors and police officers are the equivalent of the modern day guardians. They are literally almost the sheepdogs, always on watch, always watching the herd, never off, looking for the wolf. Where's the wolf? Where's the wolf? Where's the wolf? The problem is all of those skills that we train, and I'm involved with academy training, all of those skills that we train an individual to be a really good law enforcement officer, unfortunately carries over to their personal life. You don't believe me? Go have lunch with a cop. He's going to sit in a place where he has 360 degree vantage point of the entire place. He's going to know where every single exit is, or she's going to know where every single exit is, and they're going to be scanning every individual that's in that restaurant to look for potential threats. They can't shut it off. And that has a devastating effect on individuals' personal lives. I bet if we actually polled nurses and doctors, you have some similar situations. Maybe not so much where you're looking for the wolf, but can you really turn off all of those stresses that you deal with, especially during a pandemic? So during a regular time period without a pandemic, law enforcement is stressful. Next slide, please. Now we know that based upon the work that we've done with Cop to Cop. Cop to Cop's been in existence for 20 years. And these are the top 10. They received 87,535 calls over the course of Cop to Cop's existence. Depression, post-traumatic stress disorder, anxiety, finances, marital problems, substance abuse, legal problems, suicidal ideations, sleeping, medical issues, family issues, parenting are the normal calls that Cop to Cop receives in dealing with law enforcement. Next slide. Now we interject COVID-19. and the duration, the size, the scope of the pandemic when this happened, and the fact that this was uneven throughout the state. Up in North Jersey initially, as COVID-19 started to happen, February, March, April last year, the numbers were much different than South Jersey and Central Jersey. Burnout, traumatic stress, anxiety, depression, post-traumatic stress disorders, sleep disorders, insomnia, suicidal ideations, acute stress disorders, fear of infection, officers or family, officers actually sleeping in garages. How many of you that have families at home slept in a garage or slept in another room with regards to this? Numerous psychiatric disorders post-pandemic. The slide that the doctor previously showed, and the duration of this, where we're not talking about an event that happened immediately, but a long event. Higher risk of suicides. Unfortunately, there were suicides of law enforcement officers last year. Unfortunately, even with all our efforts, there has been a suicide of a law enforcement officer this year. Next slide. So what does it mean to be resilient? We all were resilient at one point. We all were kids at one point, right? Suck it up, just move on. With regards to this, gratitude. You take a dose of gratitude may shift your focus, may cause feelings of abundance, decrease feelings of fear and anxiety. Next slide. There are 4 core principles in our resiliency program. I have just about 6 minutes left to talk to you about everything I need to talk to you. Our resiliency program is a 2-day training, and it's not death by PowerPoint. Rather, it is a situation where we actually have a block, 13 separate functional areas, and then we have a number of breakout sessions where it is designed to break down the walls that everyone has built up over the years, especially law enforcement officers, based on four concepts: physical, mental, social, and spiritual. Next slide. Mental, the ability to effectively cope with unique mental stressors and challenges needed. Physical, the ability to adopt and sustain healthy endeavors needed to enhance health and wellness. Social, the ability to engage in healthy social networks. And spiritual, the ability to strengthen a set of values, principles to sustain a sense of well-being or purpose as well. All 13 separate functional areas of our program are designed to engage in this program and engage in these 4 core principles to change a culture, to change actually officers seeking help and helping each other and seeing the signs of potential burnout. Next slide. So I asked our comms to basically, we have 13 separate functional areas. There's a lot of things going on this slide, but this is the entire course on one slide because of time. Counting your blessings. We talk about managing emotions. We talk about maintaining behaviors, balancing your thinking, capitalizing strengths, accepting mindfulness, problem solving, as was previously discussed in the previous lecture, deepening connectivity, bolstering principles and self-values, being an active listener, setting realistic goals. These are all basic concepts that are part of our program. Next slide, please. I'm going to focus on one thing. It was touched upon in the previous presentation. That's gratitude, and how gratitude in our program can actually change perspective. Gratitude and other positive emotions can undo the effect of negative emotions. Bad things happen. That's just life. A lot of bad things happen in a pandemic. You have all experienced things that the human brain is not meant to actually comprehend at the level in which you have done so, even in the healthcare profession. Instead of spiraling down when those events happen, which is the first arrow, is there a method? Are there tools in the toolbox that individuals can learn to actually spiral up? The AG has talked about this on a number of different occasions, of spiraling up. Can you actually spiral up? Can you actually post-activating event? Next slide. Post-activating event, through the resiliency training that we've created, instead of going down that rabbit hole, that very dark hole after that adverse traumatic event, where we're dealing with anxiety, anger, substance abuse, sexual violence, isolation, rather we grow. And are there tools in which we can actually learn to do so? And the answer is yes, through positive psychology. Next slide. So I'm going to go through 2 examples, 2 limited things that we do. And we tell our officers, when you wake up in the morning, what's the very first thing you do? Do you complain about your knees hurting? Do you complain about this? Do you complain about that? We train our officers part of the resiliency program. Very first thing you get out of bed, you open your eyes. I want you to ask one question. What are you thankful for? Gratitude. Because whatever answer you come up with, that's going to provide your why. That's going to provide your drive. That's going to provide the thing that pushes you through, to push you through whatever you're dealing with, your why. Another thing that we do in the resiliency program, for example, we talk about gratitude and counting blessings. We actually have the officers write a letter. And they write a letter to someone who has had a profound impact on their life. That person may not even know it. And they write a letter and they read it in class the very next day, because it's a 2-day training. And they specifically provide us that information. And then if they really feel comfortable, they call that person and read the letter to them. It could be someone who's alive and someone who's dead. Do that. It's amazing how well you would actually feel. We did a number of things on the proactive side, the third part of my presentation to you. In the height of the pandemic, we actually created a Resilient Minds on the Frontlines. On the frontlines.us is the website. The Mercer County Prosecutor's Office, DCJ, and a number of individuals throughout the nation, resiliency program officers, created 33 separate webcasts. Next slide, please. We called it 15 Minutes of Hope and the World Turned Upside Down. We created 33 of them. We're in production of season 2. We also started to do a number of actual presentations on that. And I highly encourage you to actually read it. They're 15-minute snippets to provide some of the basics of the resiliency program. Next slide. And I know you're going to get this, so I'm going to go through rather quickly. So on the mental prong that we talked about, these are episodes that deal specifically with that. Next slide. On the physical, these are all the episodes that deal with that. Next slide. On the social, we talked about, these are all the episodes that deal with that. And on the spiritual, next slide. These are all the episodes that deal with that spirituality as well. Next slide. We have been extremely proactive and having RPOs being proactive during the height of the pandemic to ensure we have those social connections and are reaching out. For example, our RPOs have reached out statewide to a number of individuals and internally to staff as well to check on their well-being. Next slide. When in fact an individual is beyond resiliency but needs help, then we return to Cop to Cop. This is Cop to Cop's 1866 Cop to Cop. Next slide. There was a 104% increase from January to April of 2020 in calls to Cop to Cop. In March, we actually statewide pushed out the resiliency program of this year. Next slide. As a result of the resiliency program and the pandemic, we've had over 12,643 calls Cop to Cop, either to or from. 5,096 were actually RPO calls. 511 were Blue for New Jersey calls. That's corrections line. Overall, 19,970 calls of getting help. You don't need to be suicidal to call Cop to Cop. That's a misnomer. Next slide. These are some resources available. Again, sort of dovetails the previous lecture. Next slide. This is a new hotline that was just created. And if you go on their website, you will see this. This is specific for COVID-19. Next slide, for Cop to Cop. Basic information about it. Next slide. And the final of the 3 on that website that you would see. Next slide. It's specific for first responders. Here's my contact information. If you have any questions about this or any other thing we discussed, cpr@njdcj.org. 609-422-7663 is my cell phone number. We are interested in liaisoning with all first line responders and pushing out and modifying the resiliency program for the stresses that you deal with. I thank you for your time.
Thank you, Robert. And I know you were going through your slides at a pace so that our next speaker would have enough time and we'd have time for question and answers. And I appreciate that. And I just want to let everyone know that, again, a copy of these slides as well as a recording of today's presentation will be shared with you and will also be available on the website. after this event. So I just wanted to make sure everyone was aware of that. I think the information you shared was so important, Robert, so thank you so much again. Our final speaker for this morning is Erica Shortway. She is with the Center for Addiction Recovery, Education and Success, CARES. Erica spoke at a previous webinar with us and is here today to really speak about the impact that the COVID pandemic is having on the already existing opioid crisis and how it is impacting our frontline workers in that field. So Erica, welcome, good morning.
Yes, hello, thank you. My name is Erica Shortway, Director of Recovery Services at Prevention is Key's recovery division called CARES, the Center for Addiction Recovery, Education and Success. It's an honor to be here today with you all, getting an opportunity to heal out loud and share with you my experience as a peer worker on the front lines amidst a pandemic. Thank you to the Partnership for a Drug-Free New Jersey, the Office of Attorney General, and NJ CARES for creating this space today. Next slide. I am a woman in recovery from chaotic substance use on my chosen recovery path since November 11th of 2011. In these 9 years, I have created a life filled with so much joy and hope. Besides becoming a mother to 2 amazing little humans, working as a peer in the recovery field the past 8 years has become my purpose in life. Being able to turn some of the most painful experiences I have gone through into a message of hope and inspiration is not only healing for my own process, it also helps me empower others to heal and find their own recovery path. I started peer work in the recovery field in 2013, volunteering at a recovery house that I lived at in my early recovery. In 2014, I became a paid staff as the assistant to the director. My experience working at this recovery house fanned that flame in me to be of service to the community and empowered me to pursue more ways to serve this field. Next slide. I discovered CARES in 2015 through a Super Bowl commercial that shed awareness on the overdose crisis in America. With a background in public relations, I knew how expensive that 30-second commercial was. And for the first time, I felt hope on a larger scale that communities are evolving to support drug users and those recovering from drug usage. I took the C-CAR recovery coach training at CARES in 2015. In 2016, I took the certified peer recovery certification with CARES, and it ignited my passion to pursue peer work as a career. I am forever grateful for the CPRS perspective that has softened my heart and mind to be a more effective helper in the world. I took a full-time position in 2017 at CARES, working as the project coordinator for the opiate overdose prevention program, providing Narcan trainings and kits to the community in the 7 northern counties in New Jersey. Through the years at CARES, I have had the opportunity to be of service to the community I love, all while raising and guiding 2 little humans with my partner. Happy birthday, Chris. It's important to mention that I started as a volunteer and was able to work my way up to a leadership position. I now get to empower, support, and lead an amazing team at CARES as the Director of Recovery Services. I oversee and manage 14 recovery and harm reduction initiatives in 8 different counties in New Jersey. Next slide. So what is a peer? A certified peer recovery specialist are trained individuals who, through shared understanding, respect, and mutual empowerment, aid in helping people. Our certified peer recovery specialists at CARES provide an atmosphere of radical love and connection to communities where all feel safe and supported on their path of wellness. We work to create recovery ecosystems in the community and make sure that resources are readily available to all in need. As a certified peer recovery specialist, I get to use my personal experience with chaotic substance use and mental health struggles to help people feel heard, that they are not alone, and that we can proudly heal out loud. This inspires candid conversations to talk about experiences and fears individuals have had seeking services and helps us remove barriers for the individual's healing path. Next slide. At CARES, we offer non-clinical peer-to-peer recovery support. Our mission at CARES is to engage and organize the community by helping individuals find, maintain, and enhance their life through peer support, as well as work to reduce stigma associated with substance use through advocacy, education, and service in the community. On March 16th, we feared the worst, that the community and connection so desperately needed may be inaccessible. For those in the grips of a hopeless state of mind with substance use, community and connection is such a foreign concept. That fishbowl mindset creates this illusion that you can never be free from it. Throw in a traumatic world experience like COVID-19 and it seems that much more unattainable. At CARES, I have always been so humbled to see the heartfelt warriors doing whatever it takes to smash that illusion. COVID-19 refueled our deep passion to make recovery accessible to everyone and anyone. This meant having to get creative. Next slide. Within 24 hours of the news of state quarantine and shelter at home, we made sure that all of our recovery support services were available to all in need. We had all our mutual aid meetings virtual through the Zoom platform. We added more to our normal scheduling to make sure that we had enough anchors throughout the day to keep people afloat through such a challenging time. We had on-demand Zoom one-on-one recovery coaching, as well as our 24/7 peer support line available. Within the first month, we had tripled our reach, serving 845 individuals. To put that in perspective, in the previous year, 2019, for the month of March, we served 381. That is a 222% increase in services. Next slide. We also set up virtual Narcan trainings and mail-out options to get the life-saving antidote out there. We went out on Morris County Hope One, bringing vital recovery services out in the community. We launched Passaic County Hope One that expanded our harm reduction services in Passaic County to include safe usage kits, fentanyl test strips, and condoms. We created more daily recovery program and collaborated with Prevention Link peers on activities like virtual open mics, virtual Netflix and chill nights, virtual escape rooms, and virtual recovery hangouts on Zoom, playing games like Pictionary or trivia. Collaborations like this help unify recovery centers in New Jersey. We made sure that those getting out of treatment or incarceration were immediately secured and connected to recovery support and care packages. Next slide. The prosecutor's office in Morris, Passaic, and Essex County teamed up with us through Operation Helping Hands to make sure more recovery services were accessible by doing things like community outreach days. It takes community wellness initiatives like Operation Helping Hands to create a type of atmosphere that unifies police with community members, offering true recovery ecosystems and building recovery capital for the people we serve and each other. CARES recently did a 2020 impact report, and I'd like to share that with you today. Next slide. In the year 2020, we were able to bring direct services to 5,426 individuals. Of that, we trained 2,019 individuals in Narcan and received 43 reversal notices. In addition, we were able to connect with 5,423 individuals through our community conversation webinars. So in total, the CARES team was able to directly impact 10,669 individuals. As proud as I am of how much we impacted the community and to serve the community with such a fierce team of wellness warriors, it took its toll on all of us. I quickly noticed these supports were not just for the people we serve, they were for us peer workers too. Next slide. With this being our life for the first 3 months before being able to get out there again, suddenly I was back to the basics of my own recovery path, seeking community and connection in a way that made me feel like I was fighting for my life, like the earlier days when I first walked out of that war back in 2011. Because even with all these services we were making available, overdoses were still rising. I recently heard a speaker talk about how much respect she has for the ones that endure heartbreak, who still stand on the front lines of the overdose crisis and do the work. I am in awe of the team at CARES and the fierce tenacity and grit they embody. Next slide. As we served our community amidst a pandemic, an overdose epidemic, racial injustice, and political turmoil, we did everything in our power to serve each other too. We upped our team check-ins from once a week to twice a day. We built our morale by doing things like Spirit Week with Funky Hair Day and all. We played games like Show and Tell, Two Truths, One Lie, and Harm Reduction Shark Tank. But most importantly, we shared with each other when it was becoming too heavy. We lived by the saying, it's okay to not be okay. In order to feel comfortable to share our innermost feelings, we had to cultivate a culture of collective care, where the team recognized our unified pain and struggles and created atmosphere of love and support for each other. We honored each other when we were not okay, and for some of us, we need permission to feel the negative emotions too. Next slide. Usually a peer has lived experience to help the individuals we serve, but this was new to us all. We have never been through a pandemic before. We were using our lived experience in the moment, and it was a roller coaster of emotions. As peers, we do our best to find a balance between becoming enmeshed with and avoiding becoming too detached in this work. Yet inevitably, we absorb all our experiences, both the positive and the negative. Peer work can be very filling to the soul, but it can also be very demanding. It is vital that the appropriate anchors are in place, both in a professional aspect and a personal way, for peers to remain resilient and not encounter fatigue. Focusing on the collective care as well as self-care for our peer team has made a difference. Collective care focuses on an individual's well-being as a shared responsibility amongst the team. For us at CARES, having an agency that allows us to get creative with making sure our peers are taken care of physically, emotionally, and mentally has been a huge anchor to holding us up through the fatigue. For more information on collective care, check out Zone of Fabulousness by Vicki Reynolds. Next slide. Throughout the state, I watched as agencies came together even more so than ever to stand unified as vital lifelines for peer workers. This set the tone for our future peer community in New Jersey. It has always been the heartbeat of the peer philosophy to help others. Watching agencies and initiatives create support centered on helping peer recovery specialists showed the universal collective care in New Jersey. To highlight some of the amazing resources that have held us peer workers through this pandemic, I'll start with NJCARS, New Jersey Coalition for Addiction Recovery Support. They held check-ins for its members weekly. This resource in particular carried me through this pandemic. NJCARS also put on an amazing recovery ecosystem conference that focused on impact through education, innovation, and collaboration. It was fantastic and rejuvenated our spirits. NJPN, New Jersey Prevention Network, created the CONFAB, an inclusive community discussion and support group for peer workers. Each week, they have different speakers and formats for peers. And then us, Prevention is Key Cares, added more virtual Heal the Healers groups, a space to help anyone that works in this field to power up through the week. Other great resources for peer frontline workers in New Jersey is NJ Cares, the Mental Health Association in New Jersey, and New Jersey Hope and Healing. Next slide. In closing, COVID-19, though tragic and traumatic for us all, has really magnified all the passion and heart in New Jersey. I see that in this event today. I am proud to be a part of a community here in New Jersey, not just as a peer worker, but as an individual. I feel honored that I get to work for an agency that cares so deeply about the communities we serve, as well as their staff at Prevention is Key. I appreciate you all for being here today, whether for yourselves or to better serve the community. In heartfelt gratitude and respect, stay kind, stay well, and stay connected. Thank you.
Thanks so much, Erica. Again, thanks to all of our panelists. We have a few questions, or at least we have time for a few questions. I'm going to start, Robert, with you. You talked about the resiliency training. Can you speak? Is that available currently? Is it available virtually, or is it all on hold until after the COVID pandemic?
No, it's not on hold, and it is not a virtual presentation. It doesn't lend to that. So we, even during COVID, we have still been doing resiliency trainings. We liaison with all 21 county prosecutors, so we're aware when trainings happen. If individuals are interested, they can email me, and we would love for individuals to see how it translates with first responders. We would make arrangements to see if people can sit in.
All right, great, thank you. And Dr. Brazeau, we know that adolescents have been particularly hard hit with increases in anxiety and depression, and pediatricians as well. Can you speak to any advice or services for pediatricians that you can provide?
I think that the advice is applicable really to everybody. whatever specialty or whatever work that you do. I try to present things that really unite us all as humans. I think this whole experience is very humbling and brings us all back to the basics of what we need as human beings. So, and it's really the same principles as the resilience training. And so maintaining hope, maintaining gratitude, thinking about good things that have happened, taking the time, the mini breaks during the day to reduce the sustained stress. And it does apply even to folks who are not in the healthcare field. It applies really to all of us. For adolescents in particular, I think that the social connection is particularly important because that's, peers are everything to adolescents at that stage of development. And so really focusing on ways to maintain connection virtually, not letting adolescents isolate and try to bringing them into the fold, I think is particularly important.
All right, great. Thank you so much. And Erica, drug overdose deaths in New Jersey have increased significantly during the COVID pandemic. Can you speak to the impact on peer workers and provide any advice on how to get through those disappointments from people who have been on the front line, working with many people who may have passed in the last year?
Yeah, absolutely. I mean, I think it was a little over 80,000 individuals passed away from an overdose last year. That's a little over 200 a day, which means in this hour, 10 people have passed away here in New Jersey. And I believe overdose is preventable, and it takes its toll on us as peer workers when we ethically know that this is preventable, when we know that we need to expand more harm reduction services, when we need to end the war on drugs, when there's so much more we can do in the community, even though we've done so much in New Jersey, and I'm so proud of all that we've done. There are so many help groups, support groups that I mentioned. You can see them in the slide. And I feel, very passionate about expanding harm reduction services we do a lot of harm reduction, but to include, safe usage kits, fentanyl test strips, condoms, all over New Jersey, and eventually maybe even get into overdose prevention sites. Thanks.
All right, thanks. And Doctor, this question came to you, but I think as our final question, it's something that all of our speakers could maybe touch on. This question came in and said, you spoke about the need to unburden and decompress. What are the symptoms of triggers or triggers that I should be aware of? And where should I start? I don't want to be a burden on my friends and family. So, Doctor, can you take that question first?
Sure. So, I think everybody is different, and you sort of have to know yourself. If you start behaving or feeling differently than you normally do, start with some irritability, more frequent, we all have ups and downs, but you find yourself more into the down than into the up, that the glasses that you have start looking darker at things as opposed to looking at the positive side. Those are signs that you need to start using coping mechanisms. And so some of those coping mechanisms, are taking those mini breaks, like we taking time to decompress. It's hard sometimes to think that you can take the time for yourself when you're so busy and there's so many things pulling you. And there are folks who work from home and have to take care of their children. That's also a sustained stress. It's almost a mindset to say, look, I'm going to set my timer. I'm going to take the time for myself, because taking time for myself is going to help me take care of other people as well. And to have other people help each other, remind each other that you need to do that. And if all of that fails and you find yourself that you cannot use the coping mechanisms, that the symptoms persist for more than 2 months, or you just can't function the way you normally would function, that's when you need to pick up the phone, look at those resources, call a peer support line, speak with a trusted professional, so that you can just get out of the darkness and into more of a coping. It is normal to feel fatigue. it is normal to be tired right now. So it's not like you shouldn't feel anything, but to remind yourself that those feelings are normal, to be kind to yourself and compassionate to yourself, and then recognize when you're just not functioning to the level that you should, and then, and then reach out to peers, to friends, and then to professionals if you need to.
All right, thank you. Robert, do you have anything you want to add to that?
Yes, actually, you're not a burden. I agree 100% with the doctor. Talking to friends, or quite frankly, talking to family members who are probably going to be your strongest support system, and talking about what you're feeling. There's an old Japanese proverb that a very good friend of mine always reminds me as I try to take on too much, and that is, you cannot pour from an empty vessel. That translates for you as well. And speaking and talking to someone is really important. It's amazing how much better you feel when you start talking to a friend, and that's kind of how we develop the resiliency program. So talk to a friend. And if you don't feel comfortable talking to any of those individuals, recognizing that I have 723 people still on the line, you got my number. I'll be more than happy to talk to you.
All right, thanks. And Erica, anything for the people who are in your field, or in general, anyone who is on with us?
Yeah, absolutely. I feel like it's so important to have a team that you feel unified with in this work, that you can share when you're not okay, when you can connect and, power up for whatever's to come, because we know heartbreak is going to come. Collective care is that shared responsibility, like I was talking about earlier. And, thoughts, they grow in the dark. When you expose them to light, they die in the light of exposure. So just being able to trust and lean into your team, and then all of the amazing supports that are out there. Thanks.
All right. Thank you. And thank you again to all of our panelists and all of our attendees. I appreciate our panelists sharing their expert knowledge, I think, especially in the questions and in the closing comments, just so impactful. I do want to share that, again, a copy of this presentation will be available on the website, as well as a copy will be emailed to you. And there'll be additional information and resources on knockoutday.drugfreenj.org. We'll be following up with each of you as well in the email with some additional resources and a brief survey that you can complete. So thank you for that. Prescribers and healthcare professionals attending today's webinar are eligible to register free of charge for Do No Harm, Exploring Strategies for Safer Prescribing of Opioids, a pre-recorded webinar that fulfills the New Jersey 1-hour continuing education requirement concerning prescribing of opioids. Visit knockoutopioidabuse.drugfreenj.org/NJSafeRx to use the discount code knockout to get that course available without any cost. And that information is on the screen, and you'll also receive it in the email that you receive. So thank you again to all of our attendees for committing to be part of the solution to New Jersey's opioid crisis. And on behalf of the Partnership for a Drug Free New Jersey, the New Jersey Office of the Attorney General, and NJ Cares, we wish you continued good health. Have a good afternoon, everyone. Be well.